Distinguished guests and colleagues, I'm very pleased that so many specialists from both Germany and abroad have come to Berlin today to discuss this topic, which is not only medically and scientifically challenging, but also the subject of intense social-political debate. The strong turnout today underscores the relevance and international significance of this topic. It also reminds us of the great responsibility and sensitivity required of us when addressing the subject of adolescent gender incongruence. We know that the number of young people experiencing conflicts or insecurities regarding their gender identity has significantly increased in recent years. At the same time, public and social attention to this issue has intensified. This has led to high expectations of medicine and medical research, expectations to provide clear answers, offer guidance, and to propose solutions. But that's not so simple, as our medical knowledge has not yet progressed that far, and I deliberately say not yet. Gender incongruence as a multi-phase condition, yet scientific research on this subject remains insufficient. This field is defined by insecurities, open questions, misinformations, and controversial debates. Where evidence is lacking, speculations take hold. This can be observed in the often emotionalized and polarized debates. For this reason, it is of the utmost importance that physicians take their responsibilities seriously. This involves providing medical care based on scientific evidence that considers the benefits and risks while prioritizing the well-being of the individual. Medical practice may never be guided solely by the social zeitgeist or political expectations. Medicine is an applied science that is based on a shared foundation of scientific knowledge. The fundamentals are acquired during the medical school, and these must be tested, expanded, and passed on over the course of one's professional practice, guided by empirical experience. Rapid changes in medical knowledge require critical thinking. This is also, and perhaps even especially, the case when it comes to the topic of gender incongruence. Those affected justifiably expect the situation to be considered individually and to receive differentiated support along the journey. Therefore, the German Medical Assembly, as well as the German Medical Association, have expressly emphasized in their policy statements that adolescents experiencing gender incongruence require particularly careful and interdisciplinary support. For the German Medical Association, there is no question that every therapeutic approach must correspond to the current state of medical science and technology. It must guarantee individually tailored, differentiated care, and finally, it must especially consider the psychosocial and ethical aspects. Psychotherapeutic support, in line with the biopsychosocial model, a holistic approach to explaining health conditions, plays a vital role in helping patients make consistent treatment decisions and in providing responsible care overall. Our responsibility as physicians is to promote scientific progress and to shape treatment pathways not through ideology, but through a reflective dialogue and with considerations of the best possible evidence in the interest of our patients. In the interest of young people, we advocate for continued critical, open, and interdisciplinary care, and in doing so, we rely on the urgently needed medical progress, evidence, and on the indispensable international exchange of experience as it's taking place here today. I would like to close by expressing my gratitude above all the organizers of this conference, for their great commitment in putting together such a comprehensive program. I would also like to thank all of you who have come here from near and far to engage in this important discussion over the coming days, addressing this undoubtedly complex topic in a highly competent setting. I wish you stimulating discussions with valuable insights and progress toward evidence-based, individualized, human and responsible care for children and adolescents with gender incongruence. Thank you sincerely for your commitments and your expertise. Thank you very much.